Hello, everyone. Welcome to the Colorado Department of Healthcare Policy and Financing ARPA Rescue Plan Act Update webinar for August 2024. We appreciate you watching this webinar and your interest in our work and our ARPA work specifically. And I'm going to go through the agenda. If we could go to the next slide. And the agenda is we're going to give you a couple of kind of general ARPA updates. We're going to talk about some metrics, and then we're going to talk about some specific projects, one that is still currently active, and then we're going to talk about our closeout plan. We are getting towards the end of our ARPA projects, and we've had a few projects that have recently closed out, and so we want to be able to highlight those. Been some really, really good work by folks here at HCBS using our ARPA funding. And then we also wanted to provide folks just an overview of our website. If you have more interest in some of these specific projects that we talked about today, or our ARPA work more broadly, you can go to our website and we'll try to show folks how to find information. So if we could go to the next slide, and we're going to talk about some general ARPA updates here. And again, this is just some of the numbers that we pulled out. As you can see, this work started in April 2021. We are closer to the end than we are at the beginning at this point. Ends March 31st, 2025. We've had 61 projects. We've had 11 of those that have been completed. I think a couple of numbers that we're pretty proud about are we've had over 10,000 stakeholder engagement opportunities, or attendance at stakeholder engagement opportunities. And then I think, there was a total of 551 million reinvestment. We have spent approximately 73% of that money, or 404 million we have spent through the end of July. So we've been working hard trying to get that money out into the community. And then, as you can see at the bottom, we have 9 months roughly left to spend this money. So if we can go to the next slide, please. I'm going to turn it over to Emily Reddick, who is going to discuss a little bit about kind of our metrics and outcomes and how we've been tracking the progress on our projects, some of our projects and some of our work overall.
Thank you, Patrick, and thanks for getting us started. I'm very excited to share a new metrics dashboard that we will be sharing with the public very soon. It's still in the development stages, but we wanted to share some of our outcomes that we have with our ARPA project so far. Patrick mentioned a really huge amount of stakeholder engagement, and that was very important to us with this funding, to make sure that we included all the communities that would be impacted by the work. So this is our metrics and our outcomes so far on stakeholder engagement. You can see we have completed over 270 meetings, and we've engaged with over 10,000 individuals. And we've also been tracking our satisfaction after those engagements, just to make sure that the information that we're providing is really useful through each of our interactions, including in today's presentation. So next slide includes some other impact and metrics that we have. We've also been measuring our training efforts. That's a big section of our programs, is related to workforce training. We've been able to create 50 training programs so far, and we've had over 3,000 participants in those trainings. So very much overachieving with our targets that we've set out at the beginning. And same thing with our grant programs. We've far exceeded what we initially set out to achieve. We have somewhere in the realm of 1,600 to 1,700 grants that have been issued. And a lot of those grant programs have been issued to recipients that have one of the diversity classifications, which was very important to us. We wanted to really have impact with organizations that didn't always traditionally participate in grant programs because there are some barriers in participation. So very proud of these metrics. We also will have, I'm going to preview in the next 2 slides, some impact slides per area of focus. So if you all remember, we had 8 areas of focus for our ARPA projects. This is highlights of area 4, which was support for post-COVID recovery and HCBS innovation. So we have lots of projects in that realm, in the 4s realm, we call it. And these are just some highlights of some different projects that had some great easy to measure goals within the project. So our Pilot Capable program is highlighted at the top, the number of benefits that were are the recipients that are benefiting from the Capable program. Our supported employment pilot, you can see how many participants were enrolled in the pilot per quarter. And in the next slide, we have a couple other metrics that are related to our respite grant program, how many caregivers benefited from the grants that we issued, and then from the home modification budget enhancement, how many home modifications have been able to be completed through this ARPA work. And so coming soon, we will have these metrics where you can play around with them and see all the different metrics that we're highlighting across our programs very, very soon. We're really excited to be able to share that. It's very important to share that with you, our stakeholders, the impact that these programs have had all across the state of Colorado. We'll also be highlighting that a little bit later on when we show some of the closeouts, and those programs will be talking about the impact that their projects had. And I saw Amy peek up on this slide, so I will be handing it over to her to talk to you about a current active project and the impact that that's having. So I'll hand it over to you, Amy.
Thanks, Emily. Hi, I'm Amy Dearmore. I work as the Access Eligibility Coordinator here at HCBS, and I'm really happy to be talking with you about the program that has morphed from ARPA Project 5.02, which is Presumptive Eligibility for Long-Term Services and Supports. The acronym that we're using is LTSSPE. Next slide. Before I jump into kind of a high-level overview, I want to acknowledge that we do currently have presumptive eligibility available in Colorado. However, it's just for some specific targeted populations, and this new presumptive eligibility program won't impact those in any way. For LTSSPE, applicants will be able to self-attest to program eligibility. We have a referral form in the works, and we're currently looking at the best way to implement that form and reach eligible individuals using the networks and processes that we currently have in place. The self-attestation part means that individuals will be able to self-declare to meeting functional and financial eligibility, and also self-declare to meeting crisis circumstances or crisis criteria. Identified LTSS services will be provided to eligible members right away. The few select services that we're looking at to help support someone during a crisis situation and help them avoid higher levels of care or more costly levels of care include services like personal care, homemaker, respite, transition coordination, home delivered meals, a personal emergency response system, and long-term home health. Third bullet, designated entities will facilitate the LTSSPE program while someone's long-term care Medicaid application is being processed. For this program, long-term care Medicaid eligibility will be processed through current processes during the presumptive eligibility period. That PE period we're looking at being about 90 days or until someone's long-term care Medicaid eligibility is determined. We think that authorizing an entity to facilitate LTSSPE will allow county workloads and case management agency workloads to remain largely as they are. In fact, it's an important goal we have to avoid increased workloads and avoid duplication of work. Once someone's long-term care Medicaid eligibility is approved, their LTSS services will continue through waiver enrollment, ensuring continuity of care. Next slide. Here's what our plans for development look like. The state intends to implement LTSS-PE through the expansion of our 1115 demonstration waiver. 1115 demonstration waivers allow states the flexibility to pilot new programs. Our current 1115 demonstration waiver supports the substance use disorder program, and it is up for renewal. And so we intend to submit a request to the Centers for Medicare and Medicaid Services, asking them for permission to expand our 1115 to include presumptive eligibility for LTSS. Through the fall and winter of 2024, we'll be finalizing policy recommendations. A large part of the finalizing of these program details will be in response to stakeholder feedback that we are getting during this time now. And a big part of the stakeholder feedback includes a formal public review and public comment period as required by our 1115 application. And that public comment and review period will be September 10th through October 10th of this year. By January 1st of 2025, we'll be submitting our waiver application to the Center for Medicare and Medicaid Services. And then spring through fall of 2025, we will be looking at our current systems and how we need to improve and expand them to implement LTSS-PE. And we'll also be doing a lot of stakeholder support in the way of training and communications and other support as we all prepare to adopt LTSS-PE. And then you can see at the last bullet, our targeted implementation date is January 1st of 2026. Next slide. A big part of the success of this program implementation is through stakeholder feedback, and we really want to hear from you, both on the program as a whole, but also specifically on a couple of key pieces. The first key piece is about the crisis eligibility criteria. So what crisis situations do you think are important to include for eligibility criteria? What we're looking at currently includes loss or incapacitation of caregiver, having experienced a recent acute medical or mental health episode, and being a danger to oneself or others. Second key piece of feedback that we're asking for is which services do you think are important to include to help support someone in a crisis situation? What we're currently considering, I mentioned earlier, is personal care, homemaker, a personal emergency response system, respite, long-term home health, home delivered meals, and transition coordination. And again, those on LTSS-PE will have access to just a limited batch of LTSS services for up to 90 days or until their long-term care Medicaid eligibility is determined. Next slide. We have established a few different ways through which stakeholders can be kept updated and also provide feedback. We have an LTSS-PE website that will be updated as developments progress and with future stakeholder engagement sessions. And you can see I typed out the link to that website. And on that website, all the rest of these links you can find live. And that includes the Google stakeholder feedback form that will be used to collect comments and questions. On that Google stakeholder form, there are 2 questions that surround the eligibility criteria and the services questions. We also have an LTSS-PE email inbox through which stakeholders can provide feedback and ask questions. And then all the feedback gathered on the Google stakeholder form and through our email inbox can be viewed on the LTSS-PE feedback log. I also want to mention that we are in the process of establishing an LTSS-PE voicemail box for those who do not have internet access who still want to provide feedback. And that's all I have. I really want to express a sincere thank you. Thank you for listening, and thank you for your commitment to the wellness of our members. You guys, our stakeholders are really valuable partners with us here at HCBS, and we know that with your support and input and participation that this program can be really impactful. And we look forward to working with you as this program continues to grow and develop. Thank you.
Thank you so much, Amy, for that great presentation and encouraging folks to reach out if they're interested in this issue or have feedback in this issue. And we really appreciate you and your presentation today. Next, I'm going to turn it over to Haley Gleason, who is going to talk about our ARPA HCBS closeout plan. And as I mentioned at the beginning of the webinar, we're getting closer to the end than we are at the beginning. So we're trying to plan ahead to wrap up some of these ARPA projects and expend our ARPA funding. So Haley, I'm going to turn it over to you.
Thank you so much, Patrick, and thank you, Amy, for your presentation. Hi, everyone. My name is Haley Gleason. I'm the department's Economic Recovery Officer, and I am here to give you a little bit of a glimpse into where we are headed in this less than a year of wrapping up our ARPA HCBS spending plan. Next slide, please. As you can see on this slide, we have outlined some key dates that are coming up very soon as we start to wind down our ARPA activities. The first date listed is September 30th, 2024, so just over a month away from today. And on this date, we are requiring that all ARPA initiatives and their activities end at that point. So if the project has a contract, or if there are grantees that are associated with the project, all of the activities must be wrapped up by September 30th, 2024. The reason why we have that date for activities ending is because we need to be sure that we give ourselves time to get invoices from our vendors and pay those invoices out. So our goal is to be able to have all of those invoices paid by November 30th, 2024. So we really want to pretty quickly turn those around for all of our partners out in the community to get those payments made. And then our big goal is to have all of our projects closed out by December 31st, 2024. Closeout is a pretty robust process for our project teams. In addition to working with contractors or grantees to wrap up their component of the project, it's really important that our internal staff are doing the same. So they are really working hard to put a nice bow on their project and make sure everything is pulled together, including putting information out on our website for all of our stakeholders to see the outcomes and the results of each of these 61 different initiatives. So as Emily demonstrated earlier, we're really working hard to get those metrics and outcomes pulled together so that we can show both at a high level over all of these projects, but also at the project level, what were the outcomes and what were the successes that were achieved from all of this work. So that December 31st deadline is coming up really quick, and that's when all of those 61 initiatives will be closed out. And then that final date listed here, March 31st, 2025, that is our end date per the Center for Medicare and Medicaid Services, CMS. So we must have all of our expenditures complete and everything for ARPA closed out by the end of March. And so we've given ourselves, as you can see, a couple of months internally to close the books on all of ARPA and to do all of our required reporting to CMS as well as the Colorado Joint Budget Committee to make sure that we are able to demonstrate how we spent those $550 million. Next slide, please. So we wanted to give you a preview of how this will all come to close. So not every single project is going to run all the way through until December 31st, 2024. As I'm sure many of you have seen who participated in these webinars before or who get our monthly newsletter, projects have been completing over the past 6+ months as they've wrapped up their work, and that will continue. So as you can see here, we have a number of projects that will close out by the end of September. So they will be completely closed and they will be able to wrap up and start reporting out on the outcomes of their work. And then you can see we still have a lot to go. So 44 projects are in the fall and winter, having their official closeout be closer to December 31 of 2024. So lots of work ahead, and I know many of you have participated in these programs, whether as contractors or grantees or other partners, providing feedback for us. We so appreciate your partnership as we've moved through, and we're on the final push here. We appreciate all of your help in getting us over the finish line as we try to wrap up all of this work. Next slide, please. And as I mentioned, it's really important for us to keep all of our stakeholders in the loop on our project activities, including those projects that have successfully completed. So we have a number of projects we want to share with you today so that you can learn about their activities as well as how they were able to complete and what they were able to achieve along the way. So I'm going to hand it over first to Brooke Snyder. She's our workforce and sustainability specialist here at the department, and she is going to share the outcomes of 2 of our workforce projects.
Awesome.
Thank you so much.
Thanks, Haley. Yeah, hello everyone. So as Haley said, my name is Brooke, and I have had the pleasure of working alongside our direct care workforce team on a couple projects that recently closed out. So the first one is going to be ARPA 1.07 Public Awareness Campaign. And we really launched a public awareness campaign about the value and importance of the direct care workforce, specifically the HCBS workforce, really working to understand public perception and have the public as a whole really understand how important these direct care workers are in keeping our members in their homes in the communities. And so we partnered with a media agency to really hit the ground running. We conducted a ton of research just to understand public perception currently. And then we also did some stakeholdering as well. And so we really wanted to focus on the workforce and get the feedback from them, because we wanted it to feel like people could see themselves in this workforce, whether you are a direct care worker or you know a direct care worker. Unfortunately, we usually only know about direct care workers if us or a family member needs them. And so we really wanted to change that public perception. So we did some messaging feedback. We went to our direct care workforce collaborative, asked them to help us with some messaging, some colors, really just figuring out what would be eye-catching out in the community so we could really increase awareness around this essential workforce. And so we worked on an assessment framework, creating an editorial calendar, and then strategizing those campaign messages. And so that's where our stakeholder feedback really came in. It was just instrumental in making sure that the messaging was correct and was encapsulating, just the excitement around this workforce that we wanted to share. So this was implemented in November of 2023, the campaign launched, and wrapped up in March of 2024. And this was just a lot of different campaign components. We really tried to leverage just a lot of different opportunities and media outlets. So we did digital and traditional media activities. We did some grassroots engagement and pushing it out to the local level. We did a lot of stakeholder sessions. And really just had what we think is a successful launch. And then we determined, hey, so okay, we've launched the campaign. Now, how do we make sure that we're having the impact that we wanted to make? And so if we can go to the next slide, please. This will give us a little bit of information about the metrics and the outcomes and really how we measured success. And so for a media campaign, we really focused on impressions. And we, like I said, we did just a handful of different media outlets. We did social media outlets. We even had a bus in downtown Denver. The RDT bus had a wrap on it that was driving around 16th Street Mall, which we thought was really cool. And we loved hearing from our stakeholders. Like some of our workers specifically would report back to us and say, oh, hey, we saw the ad on the bus downtown or whatever. And so it's just a really cool and exciting experience because we felt like it was workforce pride for them, but also just awareness about how important they are in these roles. So I'm not going to read out the numbers to you, but you can see that our out-of-home advertising impressions surged from 1.7 million up to over 7 million. And so that's those bus wraps, the billboards, anything that you're kind of consuming as you're outside of your house. Radio impressions also jumped from just under 10,000 to almost 50,000, which is great. TV and streaming. So we did traditional TV channels as well as streaming. So we did some YouTube and some Peacock, which we got a lot of really great feedback from. Print impressions as well. Just having a lot of a lot of success in terms of like click-through rate. And if somebody saw the ad, how likely they were to actually click through and go to the website, which is a great time for me to mention that the website that was created out of this is still up. It's still relevant. It can be found on our HCPUF website under Direct Care Spotlight. And that is where we have like social media toolkits. You can download pictures to put on your own social media. The sustainability plan of this was really to ensure that providers themselves could continue to use these media items in their own recruitment and retention efforts. So if they're hosting a job fair, they could click into some of these and use some of these images and stuff that we had created. So we want it to be a continuation and not just like have these media images end with the end of ARPA. The other thing that we're doing is the Direct Care Worker Appreciation Week, which was a House Joint Resolution this year. So we'll continue to tap into those resources that were created as well as we have Direct Care Worker Appreciation Week, the first full week of April every year. So really successful. We learned a lot. And we feel like at the end of all this, we were able to increase knowledge and awareness around this critical workforce. So a success all around. If we could go to the next slide. I'll talk to you a little bit about the other project we recently closed out, which is our workforce compensation research, ARPA 1.09. And this kind of goes hand in hand with working with that direct care workforce recruitment and retention piece. And so we really wanted to look at a holistic, complete, total package picture of what keeps people in jobs outside of just wages. As you may know, we've been doing some base wage increases over the last couple of years. So we wanted to look at compensation more as a total package versus just wages. So what sort of things help people in their jobs that weren't wages? What kind of benefits did they want to have? What made them believe that this was a quality job that they wanted to stay in? And so we really dug into and partnered with a firm to do some research around innovative opportunities for just increasing recruitment and retention and different ways to keep people on board. We really wanted to look at the cliff benefit effect. And if you're not familiar with that, that's when lower wage workers like our direct care workforce sometimes rely on public assistance. So like they may be on Medicaid or child care assistance program, and then they get a 25-cent raise and they end up losing their public assistance, but like they're losing so much more on a monthly basis than they were making 25 cents more. So it may kick them off of their benefits and then they fall off the cliff because they're not making enough to make up for that. So we really wanted to look at that. We love the idea of looking at childcare, ways to innovatively provide that to workers to keep them where they need to be, explore funding for shift differentials, and just better ways to support our low-income workers while we work to kind of increase that wage. We did have to pivot a little bit because while there's a large understanding of the benefits cliff, there's not a lot of work being done around it. And so we continue to just kind of keep a pulse on that in education, but we weren't able to find a lot of that within other states. So we were bummed about that. But this was able to identify some strategies that can support retention, which we determined is the best form of recruitment. So while we weren't able to do exactly what we wanted initially, the report did come back with some recommendations, which I believe are on the next slide. So some of the metrics and outcomes from this report was a suggestion towards direct care worker peer mentoring, tiered compensation tied to competencies and benefits, an increase of direct care workforce data. We know that there's not a lot of data surrounding the direct care workforce currently, and so really finding ways to track and manage that, which we're doing through a direct care workforce survey. And then there's also part of that, which is a case management report, which was tied to performance pay and tiered compensation. We continue to work with our stakeholders as a sustainability plan on building framework for mentorship. We actually applied, the direct care workforce team applied and was selected for a technical assistance opportunity through the Direct Care Workforce Strategy Center. So we're actually working with a team to build out a peer mentoring framework. So this report was instrumental in that. This ARPA project was instrumental in that. And we continue to leverage our Direct Care Workforce Collaborative. They provided feedback throughout this report and are still instrumental in identifying action that they can take forward from this report. And then the case management report will be utilized internally as part of case management redesign and case management best practices. So all in all, lots of great information and lots of launching points to new action.
Hi, I'm up next. I'll be presenting on Project 2.03, which this project focused on the landscape review of national and state policies for institutions of mental disease. This is an outdated term, but we still refer to it as IMD. Ultimately, this project led Colorado to pursue new policies and mitigation efforts that will support Health First Colorado members that require inpatient psychiatric care. Through this, some key project activities and achievements is we completed our landscape review. We also have the behavioral health campus policy completed to address mitigation efforts. This can be found on our IMD HCBS website, as well as we focused on submitting an 1115 SMI waiver. And then could you go to the next slide? So some key project updates and milestones that we achieved. Through this, Colorado decided to submit an 1115 amendment request to CMS. This amendment request was submitted on April 1st of 2024. In it, it requested that Colorado can cover inpatient IMD stays for individuals up to 60 days while maintaining an average length of 30 days. This is a big step. Currently, Colorado covers an in lieu of service, which covers up to 15 days max. This amendment is currently under review with CMS, and Colorado requested a go live date of July 1, 2025 for this. Another key outcome for this is HCBS launched a monthly IMD forum where we addressed and explored barriers to care. This forum is going to continue on, and we will be holding it quarterly now instead of monthly. And if you want any information on that, that is also on our IMD HCBS website. And everything will be updated there. For next steps on our 1115 amendment request, that'll be posted on HCBS 1115 waiver website. That's the update I have for Project 2.03, and I will pass it on to 6.13. Thank you.
Thank you, Nicole. Hello, my name is Joanne Svenningson. I am the HCBS IT Operations Section Manager, and I'll be speaking with you today about 6.13 connects CMAs to admission, discharge, and transfer data. This is a pretty exciting project. We increasingly have more access to data, and this pilot allowed us to provide admission, discharge, and transfer data from hospitals to the 7 participating case management agencies that opted to participate in this grant. With access to that information, the participating agencies were able to leverage information for members in their particular catchment area regarding those members' functional needs, services, and supports relative to potential changes that could flow downstream of a hospitalization, as well as the identification of potential critical incidents. So on a daily basis, a contracted staff within the department was able to deliver and distribute human readable and user-friendly data regarding ADT. So the data was manipulated in a way that was easy for agencies to review and then take action as appropriate based on their workflow and their particular organization. The department also conducted monthly stakeholder meetings and conducted surveys about how the data was being used, and leveraged that information and those collaborative spaces to identify opportunities for agency collaboration regarding the ADT data. Another activity that was completed was the establishment of how ADT data can be used to improve critical incident reporting. And a primary outcome was that we were able to distribute 290 days worth of ADT data during the pilot. We also spent over 30 hours collecting, organizing, and speaking with stakeholders to inform the final recommendation report. And in that final recommendation report, the analysis demonstrated that ADT data impacted an average of 704 members per month across the participating 7 agencies. What the department has been able to do with the information learned from that, from this pilot is we are going to be making recommendations for how that data can be presented more effectively in our care and case management system, and implementing that in a systems change that will be rolled out statewide to all users of the care and case management system. So it's been a really exciting project that occurred between January of 2023 through December of 2023, and we feel like we've learned a lot from the participating agencies, and think that this is going to positively impact how care coordination happens, and how our case managers are able to proactively work with this information to support members and identify critical incidents. So thank you for your time this afternoon, and I will hand the floor over. Thank you.
Great, thanks, Joanne. This is Max Winkler. I am the Strategic Unit Supervisor within OCL. I am giving a brief update about the 6.05 Member Tech Literacy Project, which wrapped up several months ago. This was an exciting project to be a part of. We partnered with some exciting partners, the Center for Inclusive Design and Engineering and the Colorado Office of Employment First, to develop a first in the nation form of digital literacy training that's offered to our members. We did it as a pilot program. We really recognize that there's a huge gap in training members who specifically are receiving LTSS how to essentially benefit from all of the rapidly increasing technology that's available to them, specifically as it relates to their Medicaid benefits. There's a lot of digital literacy and tech literacy that's offered and developed for older adult populations, which is fantastic. And we wanted to use that as somewhat of a model, but we definitely knew that there was going to need to be some adjustments and modifications for a completely different population of those who might have a cognitive disability, a developmental disability, or even some sort of physical disability. So this project, as I mentioned, had the goal of creating 2 learning plans. One plan was for members and one plan was for a trainer. So we had both a member-focused training and a train the trainer training. The intent of the training the trainer was that this would be something that we could roll out to the broader community and make available for anybody who's interested, whether that be a family member, a service provider, a case manager, and all of the training modules can be broken apart. It's recommended that people do it front to back in totality and skip, sections that they might already be familiar with. But it's also totally plausible that somebody could do one section on, say, something like cybersecurity, if that were a concern, and make this available in perpetuity with some updates for free to anybody who would like to access it. So this was fun to do. We developed some really great modules. Another part of the project was conducting a scholarly lit review, which is linked on this slide, to what the actual literacy landscape for individuals is with people with a disability. That can be found on our website and read through. It's really nicely done by the Center for Inclusive Design and Engineering. As I mentioned, those 2 training programs were created. There's a digital literacy coaching facilitation guidebook that's available to anybody who would like to, take a look at this and train themselves on how they might be able to administer it to somebody in the community. And then finally, the pilot itself was able to train 29 volunteer learners. These were all HCBS recipients on different waivers. And they all received an iPad, and their trainer received an iPad, and the training was developed around iPads because while digital literacy is also a gap, hardware and technology, actual hardware access is a gap as well. So we wanted to ensure that anybody who was participating in this pilot had a device that they could be trained on. And we recognize that that's a continued issue, as is access to high-speed internet access around the state. So we worked in partnership with the governor's office to ensure that those were also priorities being addressed outside of this project, which they are. So we definitely tried to keep those separate, but we did provide iPads to the participants. The coaches, like I mentioned, could be anything from service providers, family members, friends, case managers. We had a good representation of different types of service providers. And the training is now available on the internet. So I have a link here on the slide that anybody can access. We'll drop it into the description of the YouTube video along with all the other links. that's been presented in this webinar. And Center for Inclusive Design and Engineering and Colorado Office of Employment First are looking forward to finding funding outside of ARPA to improve, enhance, expand the curriculum that's available in this. So we have hopes that this will be available for a while and it will be updated as technology changes. And to give you a sense of the various topics that are covered in the training, we have things like introducing people to the concept of apps and how they work and how to use them, navigating digital health resources, so how to seek public and reputable healthcare resources online, using website portals that's so common for us these days, whether it be with a medical provider or another type of provider, they might have a portal that you have to create an account for. So teaching people how to do that. Several sections on cybersecurity. That was a huge focus based on feedback we received from stakeholders on the front end in terms of barriers or concerns as it relates to members accessing technology. And then online etiquette is another thing, learning what to expect and how to practice online etiquette, rules of conduct. And then finally, communicating across channels, whether that be email, virtual meetings, text messaging, all forms of communication that are used, especially in the healthcare space, to deliver services or remind people about appointments. So we hope that you all are able to take a look at the modules, share them with your friends, other providers, members that you know, and please give us feedback. There's an opportunity to give feedback in the modules themselves. We would love to hear what you think or if there are gaps, and we look forward to expanding this as technology changes. So next, I am going to wrap us up by showing you all on the ARPA website where you can find more information about all of these closed projects in addition to future closed projects. So we are not only going to be presenting about them during these calls, but we will also be posting all of these resources, links, reports and such that we develop as a part of ARPA to the website. So we want to make sure that you all know how to find them. So I'm going to drag another window over, and this is our project directory page of the American Rescue Plan website. This is a searchable directory organized by both project name as well as project category. So we have 8 different categories that we organize our projects into. You also have a status here so that you can see real time which projects have completed and which ones are active. So you'll see the green checkbox with the completed tag on any of these projects. So Brooks Project, the Public Awareness Campaign, if you click on the project name, it will take you directly to that section of the page. And here's where you can read more about the project, what the achievements were, what some of the outcomes were, if there are external facing reports or websites. So here you can see there's a link to that Direct Care Spotlight webpage. Down below the workforce compensation research, we have a link directly to the creation of the Direct Care Worker report that Brooke mentioned. So this is a really good place to bookmark if you're interested in keeping tabs on the projects that are completing and all of the great resources that are being generated from this kind of once in a generation funding that we all have had the benefit of working on. So with that, I will hand it back over to Patrick and let him close us out.
Thank you very much, Max. Yeah, just really wanted to just thank folks for listening today and being interested in these issues. We try really hard to provide stakeholders information, seek stakeholder input. As Max mentioned, this is a once in a generation funding, and we hope that some of the projects that we've launched and completed and talked about today and that are still going are going to impact the folks we serve. That is the whole purpose of these projects, is to have a positive impact on the folks in Colorado and our variety of stakeholders. And so I would again encourage you, I'm going to plug the ARPA website again, encourage folks, if you want more information about just the ARPA funding overall, what we're doing, or if you want project specific information, please visit our website. And we appreciate everybody attending today, and thank you very much.